Hello, my near and dear ones. So, today I'm here to talk about my COVID 19 journey. So, recently I have been infected with COVID 19, and this is my 12th day of quarantine, and I myself completely isolated from my routine works and all. And I'm feeling pretty much normal and completely asymptomatic, even though still I have the virus in my body as of today when I am shooting this video also. So I want to share my experience of this COVID-19 with all of you so that you might get some kind of help from my talk. So when I got infected, I think on the same day, I was absolutely fine, but over the night, I have developed a fever, which is of approximately 100 to 101 degrees of Fahrenheit. And immediately I got suspected myself that I might be infected with the COVID. But like generally we do mention about the classical symptoms, generally the patients who get infected with COVID will have like running nose or cough along with the fever. But other than fever, I did not develop any other symptoms. I never had a cough from last 12 days as of today. It was like mild fever in the first 2 days. And the treatment I have taken, it was completely symptomatic treatment. I can say it was not purely for the COVID. And immediately once I suspected myself that I might got infected with COVID, I gave it a RT-PCR and it took approximately 48 hours to get clarification that I got positive. So before I got positive report, I started medications like I took Dolo, I took paracetamol to subside the fever because that was pretty important and initial step. Each and everyone have to do this, that you have to maintain the normal temperature always. Always it is extremely important to control your fever. And I took azithromycin just because of the prophylaxis, and even though I did not had any kind of itching on my throat or I did not develop any cough, so I did not take any antitussives or any cough medications, and I did not take any of the cold medications also because I did not had cold, other than I had a severe headache along with the fever. So once I got positive, then I started the course completely different, and I took ivermectin because here in this video I don't want to mention any of the dosages because majority of you will take the doses as per my recommendation in the video, and I'm telling each and every individual this is just to give you an insight about the overall treatment I have undergone once I developed the COVID-19, and I'm not telling anyone that you have to follow the same. Anyone who is suffering from COVID-19, whether it is mild, moderate or severe form of disease, has to consult a physician or pulmonologist nearby to get your symptoms checked, and they are the one who is going to give you appropriate medication along with the appropriate dosages. Okay, remember this point very clearly. So that's the reason I'm not talking any of the dosages here. I'll just mention about how it went through. So I talked with my few friends and with the pulmonologist Dr. Sai and my friends Dr. Rajesh Gubba and Dr. Khalil, who have been extremely supportive, and they were talking to me regularly each and every day, couple of times, to check what are my symptoms and all. Even though we know about all our symptoms, it is very much important during that state that someone who is close to you will talk to you regularly and who will give you assurance that nothing will happen, and that emotional support was pretty much important other than the medical support. Dr. Sai was also extremely helpful. He was my pulmonologist, and I spoke to him and he recommended me to take ivermectin for the first 5 days, and I also discussed with other few senior doctors who was already giving the treatment of COVID-19 in various hospitals. Other than that, from the day one after positive itself, I started taking the budesonide inhalation for the first 5 days because it is pretty much important to prevent progression of the disease or to prevent worsening of the lung complications, we can say that. So I took that inhalation, and at the same time I have taken the Fabiflu. The first day was the loading dose. I have taken 1800 milligrams of Fabiflu, which means favipiravir is the drug what we have in the Fabiflu. And from the second day onwards I have taken 800 milligrams for next 5 days. That is 400 milligrams in the morning and 400 milligrams in the evening. And I was on Fabiflu, I was on ivermectin for the 5 days. Along with that, the symptomatic treatment, that is taking the paracetamol, was going on. And at the same time, the important thing was taking the multivitamin. So I have on vitamin C and vitamin D once a week, that is 60k, and regularly every day I used to take the vitamin C. And I consumed plenty of fluids also, like coconut water and citrus fruit juices. I have consumed a lot, along with the dry fruits, because which are going to boost our immunity. And remember guys, the food what we take during these days is also pretty much important. I was consuming a large amount of green leafy vegetables, and the vegetables with the yellow and red colors, because it has the beta carotenes and flavonoids, and it has majority of the type of antioxidants which is going to boost your immunity. So taking lot of fluids, lot of vegetables which are like green, red, yellow and orange in color are very much important. Taking citrus fruit juices is very much important for all of you. And at the same time, I was on breathing exercises, and I also was checking my oxygen saturation regularly on the oximeter. It was always 98 to 99. It never dropped below 98 for these 12 days also. So I was checking that regularly. And whenever I used to do the breathing exercises, and also when I checked my own lung function test by using spirometry, it was always normal. I never had any of the breathing difficulties from the last 12 days. So that's the reason the course what you take, the food what you take, the multivitamins and the breathing exercises, and maintaining the doses properly recommended by your physician or any of the healthcare provider is very much important. So there is no need to panic for majority of the individuals that once you get infected, what's going to happen. Initially, my viral load was very much high because in the RT-PCR you will get the CT score. But because of the high viral load, even there was a little bit concern, but you should not worry, because your mental health is very much important. You should not worry at all, because diseases may progress if you are in tension, if you are worried by your own condition. That's the reason immediately you have to start your course. Take the symptomatic treatment, have the breathing exercises properly, check your oxygen saturation levels, and take the spirometry, check your lung function test, and take the proper care, and especially make yourself isolated. And because from your family members also, it is very much important that you should not spread the infection to others, because that is how you will cut the chain of the COVID-19. So that's the reason this is what happened. And recently, 2 days back also, even though I know that after 14 to 15 days, you have to do the RT-PCR again. Just for the sake, I have checked my test and it is still positive, but the viral load is very, very low, and it is almost equal to that of negative. And I will, as you are seeing me, that I am like shooting the video to share the experience with all of you guys, just to give you the mental boost that even after getting the COVID-19, by taking the proper medication, by taking the proper care, and doing the proper exercises, you will be absolutely fine. But the only thing what you have to do is just thinking that it is absolutely fine. You should not be careless, and you have to check your oxygen saturation levels. And also especially the patients who already have the comorbid conditions like hypertension, diabetes or any other condition, they have to take an extreme care. And it is very, very important, because to maintain the oxygen saturation levels. And also self-isolation is very much important, because maybe you are fine because of your age or immune status, but there is a possibility that you will infect, you will become a carrier to infect other members of your family who might be elders, who might be having other comorbid condition. They may become fatal to others. So that's the reason maintaining the social distancing is very much important during this period. And taking the proper medication is always important, but do not take the on-counter medications just by seeing the YouTube videos, or just because I am talking about all the drugs which are available. Always it is important that talk to your healthcare provider or physician what and when and where to take. Okay, so be happy, stay safe, and with all the efforts, so let's bring the life to the normal, so that it will be COVID-free country pretty soon. Thank you so much.